My name is Jacob Mwero, Manager Cardiology Services at Aga Khan University Hospital. I manage the cardiology program at the university. I'm here to talk about heart diseases in Kenya. We have three major heart diseases that we encounter at Aga Khan University Hospital, our cardiology program. One is MI, myocardial infarction, or heart attack in a layman's language. Usually with heart attack is where a blockage in one of the vessels supplying blood to the heart, it gets blocked by a plaque or fat accumulation, and then blood doesn't go into the muscles of the heart, so you experience heart attack. Patients come to the emergency room with heart attack. Some people present with abdominal pain, back pain, pain radiating to the arm, some people to the jaw, especially for the women. Different people have different way of presenting with symptoms of heart attack. So in the emergency room, what they do what we call an ECG or electrocardiogram. If there's a blockage on which side of the heart there's a blockage, then we do some blood work. It's called cardiac enzymes. And that also tells us whether it's a heart attack or it's pain related to abdominal or other symptoms or other conditions. And then after that, of course, if the blood work and the ECG are what we call consistent, showing that you're having a heart attack or suggestive that you're having a heart attack, treatment begins. Treatment can be through medication or send the patient to the cath lab, which is a mini theater. And with that, you put on a table, they inject, they put a wire in your groin or in the wrist all the way to the heart. They inject a dye, and they'll be able to see the vessels and which vessel of the heart that's blocked. And then they try to unblock it by a procedure called angioplasty. With that, pretty much usually you put a stent for the angioplasty, which is a small wire, very small meshed wire, to the blocked vessel, and the wire is left there, this small wire, to keep the vessel patent. For those who are the disease is so severe that we cannot do angioplasty, they go for open heart surgery.
We have a GE machine for doing our echocardiograms. Mainly we are able to view the structures of the heart. This includes the chambers and the valves. We are able to assess the ejection fraction of the heart. That means how the heart is able to, the pumping effect of the heart. We are able also to assess the valves by checking if there is any regurgitation or stenosis of any of the valves. As you can remember that the heart has several valves. These include the mitral valve, which is mainly the valve that is at risk of getting rheumatic heart disease. We also have the aortic valve, the pulmonary valve, the tricuspid valve. So all these valves are checked with this machine just to see if they have any defects, any morphology with them.
They open up your chest. Of course, take a look at the vessel that's blocked and bypass it or repair it. High blood pressure is so common because of our lifestyle: smoking, alcohol, diet, lack of exercise. Majority of Kenyans are suffering from high blood pressure. At least 1 in 5 Kenyan is having high blood pressure. And this is a silent killer because unless you take your blood pressure, you might not know that you're having high blood pressure. That's why we encourage people to really go and have their blood pressure checked regularly, especially if you have family history of high blood pressure, or if you're overweight, smoking, use of excessive alcohol, living sedentary lifestyle, you require your blood pressure checked frequently. People are coming to the emergency room with blood pressure of over 180, sometimes 200, the top number, and that's a very, very critical blood pressure. You can die, have a stroke, and die because of that. It affects your heart. You can end up into heart failure because of high blood pressure. We really have to adjust our lifestyle to prevent us from getting high blood pressure or chances of getting blood pressure. The other one is heart failure. Heart failure comes as a result of either high blood pressure or what we call congestive heart failure, exercise, diet, life history, and all those kind of things. It's common and it's treatable, but majority of the diseases that we encounter are the heart attacks and the high blood pressure. Causes, as I said, mostly is lifestyle change. Lifestyle, smoking, alcohol, you have the higher chances of getting high blood pressure or heart attack. The chips that we eat have a lot of fat. The chicken and the sausages have a lot of fat, and this fat is pretty much poisonous in so many ways than one. It goes and accumulates in the vessels of your body, cause narrowing. That's why you end up having an attack or high blood pressure. You go to exercise at least for half an hour. It's very, very important. Make sure you check your weight on regular basis. We all have normal weights through what we call a BMI. If you go to your clinician, you ask what a BMI is, they'll calculate your BMI with your height and weight, and they'll be able to tell you. At least up to 24 is normal. Above 24.9, it's dangerous, and they'll recommend you to reduce it. If you're people who skip medication, on and off, you make the disease and the condition worse. You make your body resistant. For those who are sick and this procedure is contraindicated, or you are severe that you require open heart surgery. Open heart surgery, of course, that's a more invasive operation. Can cost up to 1.2 million. That's expensive. The other treatment now of high blood pressure pretty much is, of course, treatment. For heart failure, sometimes patients go for surgical repair of some areas of your heart that's causing that problem, especially for the valve. Those with a valvular disease, you can go and replace the valve or repair the valve, and that makes your heart, of course, stronger. At Aga Khan, as I say, these are state-of-the-art treatments that are found in the West. Now we can have them locally. The challenges of these treatments is the cost. Cost remains so high for the local mwananchi to be able to afford. A procedure like angioplasty, it's 500,000. That's $500,000. Very few people can afford $500,000, and that doesn't include the medication that you take after the procedure. The other challenge is accessibility. Majority of these major operations are done in either Nairobi or Mombasa. Nairobi is a place where you find there are like 3 centers with cath lab and open heart surgery services. In Mombasa, we have Mombasa Hospital and Aga Khan. Mombasa, that has the procedures, but it's usually done by visiting physicians. They come once or twice a year and then they go back. But in Nairobi, they're available 24 hours, 7 days a week. But of course, as we get into the goal 2030, I hope the government will be able to increase more facilities in the rural areas, Coast Province, Nyanza Province, Rift Valley Province, at least build a cath lab or cardiology centers where the patients will be able to be treated effectively and on time. So what we are encouraging people is to prevent, change your lifestyle, prevent yourself from getting to a point where you require this procedure because they're very expensive. If you're smoking, stop smoking. If you're a heavy alcohol drinker, just reduce or stop. Lifestyle changes. You need to reduce on your fat intake or high cholesterol intake. Exercise to prevent all that.